Aliskiren, a medication primarily used for the treatment of hypertension, is gaining attention for its unique mechanism of action and potential clinical applications. This video takes a comprehensive look at how Aliskiren works and explores its diverse therapeutic benefits. Understanding the mechanism of action of Aliskiren. Aliskiren targets the renin-angiotensin-aldosterone system, RAS, at its source by inhibiting renin, the enzyme responsible for the first step of the cascade. Unlike other antihypertensive drugs such as ACE inhibitors and angiotensin receptor blockers, ARBs, that act downstream, Aliskiren disrupts the production of angiotensin I and angiotensin II, the potent vasoconstrictor and stimulator of aldosterone release, by directly blocking renin. This unique approach sets Aliskiren apart and offers a new strategy for blood pressure management. The inhibition of renin by Aliskiren inhibits the conversion of angiotensinogen to angiotensin I, preventing the subsequent conversion of angiotensin I to angiotensin II by ACE. By reducing the production of angiotensin II, Aliskiren effectively decreases vasoconstriction and aldosterone release, leading to a decrease in blood pressure. This direct inhibition of renin makes Aliskiren an attractive option for patients with hypertension who may not respond adequately to other antihypertensive medications. Additionally, Aliskiren has been shown to have other therapeutic effects beyond blood pressure control. Studies indicate that it can reduce proteinuria, a marker of kidney damage, and improve endothelial function, which plays a crucial role in maintaining cardiovascular health. These additional benefits make Aliskiren a promising medication for various clinical applications. Clinical uses of Aliskiren. Aliskiren in the treatment of hypertension. The primary clinical use of Aliskiren is in the treatment of hypertension. Numerous clinical trials have demonstrated its efficacy in reducing blood pressure levels. In a study comparing Aliskiren with placebo, patients treated with Aliskiren achieved significant reductions in both systolic and diastolic blood pressure. Furthermore, Aliskiren was found to be well tolerated and had a similar adverse event profile compared to placebo. These findings highlight the potential of Aliskiren as a first-line treatment for hypertension. In addition to its blood pressure lowering effects, Aliskiren has been shown to have a favorable impact on cardiovascular outcomes. A meta-analysis of several trials found that Aliskiren reduced the incidence of major cardiovascular events, such as myocardial infarction and stroke, in patients with hypertension. This suggests that Aliskiren may not only effectively control blood pressure but also provide additional cardiovascular protection. Aliskiren in the management of diabetic kidney disease. Diabetic kidney disease, also known as diabetic nephropathy, is a common complication of diabetes and a leading cause of end-stage renal disease. Aliskiren has shown promise in the management of diabetic kidney disease by reducing proteinuria, delaying the progression of renal damage, and preserving renal function. In a randomized controlled trial, patients with type 2 diabetes and nephropathy were treated with either Aliskiren or placebo in addition to standard care. The Aliskiren group demonstrated a significant reduction in urinary albumin excretion, a marker of proteinuria, compared to the placebo group. Furthermore, the decline in estimated glomerular filtration rate, eGFR, was significantly slower in the Aliskiren group, indicating preserved renal function. These findings suggest that Aliskiren may have renoprotective effects in patients with diabetic kidney disease. Aliskiren and its role in heart failure treatment. Heart failure is a complex condition characterized by the heart's inability to pump blood efficiently. It is a leading cause of morbidity and mortality worldwide. Aliskiren has shown potential in the treatment of heart failure by targeting the RAS system and reducing the adverse effects associated with its overactivation. In a clinical trial involving patients with heart failure and reduced ejection fraction, Aliskiren was found to have a neutral effect on cardiovascular outcomes. However, subgroup analyses suggested that Aliskiren may be beneficial in specific patient populations, such as those with diabetes or high plasma renin activity. These findings highlight the need for further research to identify the specific patient groups that may benefit from Aliskiren in heart failure treatment. Potential side effects and precautions of Aliskiren. As with any medication, Aliskiren has potential side effects and precautions that need to be considered. Common side effects of Aliskiren include diarrhea, cough, and dizziness. In rare cases, it may cause angioedema, a severe allergic reaction characterized by swelling of the face, lips, tongue, or throat. Other precautions include avoiding Aliskiren during pregnancy and in patients with renal artery stenosis or severe renal impairment. It is important to note that aliskiren has potential drug interactions with other medications that affect the ROS system, such as ACE inhibitors and ARBs. This combination may increase the risk of hypotension and renal dysfunction. Therefore, it is crucial to carefully evaluate the patient's medication regimen and consider the potential interactions before prescribing aliskiren. Comparing aliskiren with other antihypertensive medications. Aliskiren's unique mechanism of action sets it apart from other antihypertensive medications, such as ACE inhibitors and ARBs. While ACE inhibitors and ARBs target the downstream effects of the ROS system, aliskiren directly inhibits renin, the enzyme responsible for the first step in the cascade. This distinction makes aliskiren an attractive option for patients who may not respond adequately to ACE inhibitors or ARBs. Compared to ACE inhibitors, aliskiren has been shown to provide similar blood pressure lowering effects with a lower incidence of adverse events such as cough. Additionally, aliskiren has demonstrated renoprotective effects in patients with diabetic kidney disease, which may not be seen with ACE inhibitors alone. When compared to ARBs, aliskiren has been shown to have similar blood pressure lowering efficacy, but with a lower incidence of hyperkalemia. Aliskiren dosage and administration guidelines. The dosage and administration of aliskiren should be individualized based on the patient's specific needs and response to treatment. The recommended starting dose of aliskiren for hypertension is typically 150 mg once daily, which may be increased to 300 mg once daily if additional blood pressure lowering is needed. It is important to monitor blood pressure regularly and adjust the dosage as necessary to achieve optimal control. Aliskiren is available in tablet form and should be taken with a full glass of water. It can be taken with or without food, but consistent administration with respect to meals is recommended to maintain steady blood levels of the medication. Conclusion: the future of aliskiren in clinical practice. Aliskiren, with its unique mechanism of action and therapeutic benefits beyond blood pressure control, holds promise in the field of modern medicine. Its ability to directly inhibit renin and disrupt the ROS system offers a valuable alternative for patients who may not respond adequately to other antihypertensive medications. While aliskiren has demonstrated efficacy in reducing blood pressure and improving cardiovascular outcomes, further research is needed to fully understand its role in the management of various conditions such as diabetic kidney disease and heart failure. Ongoing studies and clinical trials will provide valuable insights into the optimal use of aliskiren and its potential benefits in specific patient populations. As we continue to unlock the full potential of aliskiren, it is important for healthcare professionals to stay informed about its mechanism of action, clinical uses, and potential side effects. With further research and advancements in the field, aliskiren has the potential to revolutionize the treatment of hypertension and improve patient outcomes in various cardiovascular and renal conditions. Thanks for watching.